epidemiology, we have to know the various epidemiological studies. Various epidemiological studies. Broadly, epidemiological studies are, one is observational study, another is experimental study. Broadly, observational study and experimental study. Here, observational studies are divided into two groups. One is descriptive study. Descriptive study, and another is analytical study. In case of descriptive study, we do only how many people have been affected, in which place the disease have occurred, and what is the time of occurrence of this disease. So, we describe the disease in terms of time, place, and persons affected. Time, place, person. So, in descriptive study, mainly we concentrate on time, time of occurrence, place of occurrence, and people affected. People affected. Who are the affected persons? So, in descriptive study, we just prepare a questionnaire, and with the help of questionnaire, we go to the field and ask the people who are affected and time of suffering from the disease, whether during rainy season or during winter season or early week or late week, and also the places in which place these diseases have been found mostly. So, time place distribution. If keep in mind, in case of descriptive study, we prepare a questionnaire, and with the help of questionnaire, we ask the persons who have been affected and who have not been affected. And in case of analytical study, we do mainly case control, study and cohort study. Case control study and cohort study. এছাড়া আরো দুটো স্টাডি আছে, cross-sectional study. Cross-sectional study. আর একটা হচ্ছে ecological study. Ecological study. So, analytical study mainly case control and cohort study, and also other two studies are there, ecological study and cross-sectional study. In case of experimental study, we do the field trial, community trial, or RCT, randomized controlled trial. Randomized controlled trial. Randomized controlled trial, it is nothing but a randomly selection of two groups of people. One group were given the newer drugs, and another group was given the placebo. And these two groups were followed up, and after that we will see how many have been cured in the experimental group. That means the group who got the newer drugs, and also in the control group who are given only placebo, a vitamin tablet like that. So after that we will compare. So here in case of experimental study we do intervention. Another name of experimental study is the intervention. That means you are deliberately giving a newer drug in one group, your experimental group, and another group you are not giving any type of drug. So we are doing one type of intervention. But in case of observational study, there is no question of intervention. There is no question of intervention. Even in analytical study, case control or cohort study, there is no intervention. But in experimental study, we do some intervention. Another is field trial. Before launching the COVID vaccine, field trial was done against to prevent corona infection with the help of corona vaccine, and after passing the field trial, this corona vaccine was ultimately used among the common people. And another is community trial. In case of community trial, one community, suppose residing in village X, and another community residing in village Y. In village X, you advised adoption of healthy lifestyle among all the villagers in village X. But in village Y, you do not give any advice regarding adoption of healthy style. And after 1 year, you do follow up. Again, after 2 years, you do follow up. After 5 years, you compare what is the result between these two groups. It is community trial. Here, what is the intervention? Advice of adoption of healthy lifestyle. That is intervention. So it is intervention, experimental study or intervention study. But in case of observational study, we do not do any kind of intervention. Today, I will describe this descriptive study. Descriptive study, this study is less time consuming, not so expensive, and result can be, you can get the result easily. And this descriptive study is one time study. You have prepared the questionnaire, go to the field, you collected data, and after that you analyze the data. So there are various steps for undertaking the descriptive study. First of all, you have to define the population. You have to define the population. That means in which block or in which subcenter you are going to undertake this type of study. Because if you do not know the denominator, that means the area where you are working, until unless you get the denominator, you will not be able to calculate the rate. Suppose if I ask you what is the marks you obtained in biology, you say I obtained 85. It carries little meaning until unless you say out of 200 or out of 100, or you say 85% or 80%. Clear? So that's why you have to define the population. Define the population. If the population is very large, in that case we have to take the sample, representative sample. By doing sampling, you have to take the representative sample. Representative sample you have to chosen from this population. Clear? Next is you have to define the disease under study. You have to define the disease under study. Suppose you want to know the number of underdeveloped children suffering from measles. So, before doing this research work, you have to know the working definition of measles. Working definition of measles is mainly fever with maculopapular rash, coryza, red eyes, fever with macular rash, cough, coryza and red eyes or conjunctivitis. So, these are the important findings based on which you will say yes, this child is suffering from measles. So, throughout your study period, you have to strictly follow this working definition. Suppose if you do a research work about leprosy, in case of leprosy, the working definition is mainly hypopigmented patch with loss of sensation and thickened nerves, supplying nerves. And another important point is acid plus bacilli from the skin smear, affected skin smear. So, throughout your research work, you have to strictly adhere to this working definition. Otherwise, your result will be erroneous, will not be able to elicit the true result. Clear? Next is distribution of the disease in respect of time, place and person. Distribution of the disease up to 50, your class. So, first of all, time distribution. What is the importance of knowing the time distribution? Because if we plot the total number of cases against time, number of cases along the y-axis and along the x-axis the time, and if you plot the number of cases against time, you will be able to draw exposure number of you see the number of cases developed within a short period of time. There is steep rise and steep fall, and all the cases will occur within one incubation period. All the cases will occur within one incubation period. Have you got any idea what is incubation period? পড়ানো হয়েছে বেসিক এপিডেমিওলজি? পড়ানো হয়নি? So, you have to know the important definitions of epidemiology. One is what is prevalence, what is incidence, what is epidemic, what is endemic, what is incubation period. Incubation period means entry of the organism within our body and development of manifestations. Entry of the organism, and after that the organism will multiply, and after that there will be manifestations of fever or macular rash, and after that the person will recover. So, from entry of the organism and starting point of appearance of signs and symptoms, this period is the incubation period. So, all the cases will appear within one incubation period. There will be rapid rise and rapid fall. With the help of this epidemic curve, we will be able to identify the source of epidemic. Suppose after taking meal in a marriage party, out of 100 people, 30 people suffered from food poisoning. So, if we draw the epidemic curve, we will be able to identify the source of offending organism. Clear? Here, with the help of time distribution, we can identify the source of infection. Another epidemic curve is here exposure occurred, and after that there will be gradual rise and there will be gradual fall. With the help of this curve, we can identify the source of infection. If the people of a village drinks water from a contaminated well, then there will be repeated exposure and there will be gradual rise of cases, and after development of body's immunity against the polluted drinking water, there will be less number of cases, persons will develop resistance. So, that is why there will be gradual fall. So, here is multiple exposure, single source but multiple exposure. Another is propagated epidemic. Gradual rise and gradual fall, that is propagated epidemic. In case of measles infection or in case of COVID infection, as it is transmitted from person to person through airborne infection, through cough or sneezing. So, it is a airborne infection, and ultimately almost all people will be affected until all are immunized or until all the susceptible persons are exhausted. So, it is a curve of propagated epidemic. So, with the help of this epidemic curve, we can identify the source of infection, modes of transmission, how the disease is being transmitted, and also the place. Another important is spot map, geographical spot map. With the help of geographical spot map, suppose এখানে একটা পন্ড আছে, ছোট্ট একটা পন্ড আছে, এখানে একটা স্কুল আছে, in the month of July, we will see that most of the gastroenteritis cases occurred in and around this pond, but few cases occurred near the school. Why? Probably the people residing around the pond use the pond water for drinking water purpose, but in the school probably there is a deep tube well, and that is why children are less affected. So, in the year 1854, Robert John Snow hypothesized that cholera was due to drinking of contaminated water. That means cholera is a waterborne disease much before the discovery of Vibrio cholerae. Vibrio cholerae was discovered probably in the year 1880 or after that. So, in the 1884, only with the help of geographical spot map, John Snow told that this cholera is a waterborne disease. He did this study in the Broad Street area of London, and he found that in the Broad Street area who used the drinking water from the underground sewerage system were affected mostly, but who drank water from the Thames river were affected less. So, with the help of this spot map, we can say that yes, these are the areas where we must give more attention for prevention of this disease. Clear? So, these are the important points about epidemic curve, about spot map. Next is place. Is a spot map, it is a part of place. In which place, in which places these cases are mostly occurring. You can also draw the serial spot map. Serial spot map. Serial spot map. Suppose in the year you found that number of poliomyelitis cases were mostly found in the, say, near metropolitan city of Kolkata. But in the next year, you found that number of cases has drastically reduced in Kolkata, but many cases are being reported from Mumbai. So, with the help of serial spot map, you can identify the areas where you deploy your health personnel, where you give extra precautionary measures for prevention and control of this disease. So, these are the place distribution. You can also collect data about various cancers in various countries. If we collect data about cervical cancer, it is found that cervical cancer are mostly found in India, whereas cervical cancer is less in the Western countries. If we do the, if we take the history of stomach cancer, it is found that in the Japan, stomach cancer is more in comparison to India. So, these studies will not pinpoint what are the causative organisms, but it will throw some light about the important factors which have some role for the occurrence of this disease in a particular area. There is also variation from urban area to rural area. In urban area, many people are suffering from hypertension, diabetes, and also the mental health problem. But on the other hand, if we do the research work in the rural area, it is found that among the rural people, communicable diseases are more. Communicable diseases like ARI, diarrhea, diphtheria, tetanus. So, in rural area, more people are suffering from communicable diseases, but in the urban area, more people are suffering from non-communicable diseases like hypertension, diabetes, cancer, accident. Clear? So, in this way, we can describe the cases in various places. Next is person. The diseases are many diseases like diphtheria, pertussis, measles. These are mostly found among under 5 children. But these diseases are comparatively less among the adult persons or among the elderly. So, we can analyze why these diseases are more common among the children, why these are less common among the adults. There are certain diseases which are more common among the elderly people, like coronary heart disease, hypertension, diabetes. These are more common among elderly people. Osteoarthritis. So, by analysis of your data, by doing analysis of your data, you can identify the risk group. You can identify the risk group. If you identify the risk group, you will take preventive measures to protect the children. Suppose diphtheria, neuronal tetanus, measles, Japanese encephalitis, childhood tuberculosis, these are more common among the children. So, mothers or the caregivers are advised to bring their children for immunization of their children, so that the children will not suffer from this type of disease. So, you strengthen the immunization system where children are not fully immunized. You give extra thrust in that area. You undertake special camp for doing the for vaccination of unimmunized children. In that way, you will try to vaccinate the children as much as possible. And if we are able to vaccinate the children, if all the children are fully immunized, then these childhood diseases can be prevented to a great extent. Now let me know what is fully immunized. Any idea? Fully immunized. একটু পড়তে হবে, হ্যাঁ টাইমটা হয়ে এসছে, আমি আর 2 মিনিট টাইম নেব। Fully immunized mean all the vaccines were given to an infant. Infant means what is the age group? 0 to 1 year. So within 1 year, all the children must be immunized with all the vaccines which are due to them. Up to 1 year, যে ভ্যাকসিন দেওয়ার কথা সবগুলো তাকে দিতে হবে, ইনক্লুডিং BCG, pentavalent, rotavirus vaccine, hepatitis B vaccine, JE vaccine, measles vaccine, এগুলো সব ভ্যাকসিন দিতে হবে। এখন আবার নতুন তো অ্যাড হয়েছে নিউমোকক্কাল ভ্যাকসিন, সেগুলো দিতে হবে। তারপরে পোলিওমাইলাইটিস প্রিভেন্ট করার জন্য পোলিও ভাইরাস ওপিভি ওরাল পোলিও ভ্যাকসিন দিতে হবে। এখন ওপিভি আবার দুটো দেওয়া হয়, একটা ওরাল, একটা ইনজেক্টেবল ফর্ম। তাহলে if all these due vaccines are administered to an infant within 1 year, then only we'll be able to say that this child is fully immunized. If a child is fully immunized, almost all childhood vaccinal diseases will be prevented. Clear? Next point is so it is the distribution of time, place and person. Then after collection of data, you have to analyze. You have to analyze how you have collected data and these people are suffering out of total number of children you surveyed. So you will calculate the rate, and after that you will compare in various groups. You will compare among the various groups whether these diseases are more among women or more among the adult persons, whether diseases are more among the childbearing women or among the elderly women, whether diseases are more among the infants or it is more among the 1 to 5 years age group. In that way, you will analyze the data, and after that, after analysis of this data, you will hypothesize why this type of findings. So, you will try to give an important hint regarding occurrence. John Snow, he hypothesized that cholera is a waterborne disease based on this spot map. So, based on your study findings, you will hypothesize that this disease is due to this offending organism. So, hypothesis means proposition. It is not a full proof, but these hypotheses can be tested with the help of this case control and cohort study. So, today these are the descriptive important points for descriptive study. First of all, you have to define the population under study. Next is you have to define the case definition, working definition at field level. Next, you have to collect data in terms of distribution of the disease in terms of time, place and person. And after collecting data, you have to analyze the data, what is the rate, what is the ratio, what is the proportion, and after that we will compare among the various groups, and finally we will come to a conclusion. Conclusion means you have to hypothesize these diseases are occurring probably due to these important factors. Clear? So, this is the observational study. In the next class, I will describe analytical study.